Okay. Hello, I am Michaela Petty. I'm the epidemiologist with the Greater Boroughs Partnership for Health, a collaborative serving Boylston, Northborough, Southborough, and Westborough. And today I am joined by Dr. Patty, a local veterinarian, to talk about bird flu. Before we jump into kind of what bird flu is and the nitty-gritty, I'll give you, Dr. Patty, some time to introduce yourself and tell us a little bit more about your background.
Oh, hello. I am Dr. Karen Patty. I'm a veterinarian at Artemis Veterinary in Northborough, Massachusetts, and I am honored to be with you this evening.
Awesome. Thank you so much for joining us. So, just to get started and kind of set the stage, can you tell us what bird flu or H5N1 is?
Yeah, so bird flu or H5N1 is a subtype of the influenza A virus, which causes avian influenza, which we call bird flu. In birds, it is shed in the saliva, mucus, and feces of infected birds. And these are both domestic birds and wild birds, such as migratory birds. Other animals can shed the flu virus in their respiratory secretions and other body fluids, such as milk. The virus can spread rapidly through poultry flocks and among wild birds. Um, some of the symptoms of bird flu in birds, including backyard poultry flocks and even pet birds, you can see signs such as low energy or low appetite. You can see a purple discoloration or swelling of various body parts. You can see a reduction in egg production or even soft shelled or misshapen eggs. You can see respiratory signs such as nasal discharge, coughing, sneezing. They can have a lack of coordination. They can have diarrhea. And some birds will even show sudden death with no prior signs of illness whatsoever. Yeah. Um, this avian influenza, it does affect cows, as we know, most especially lactating or milk producing cows. In cows, it is a much less virulent virus and mostly causes a reduction in milk production or an abnormal color or appearance of the milk, such as a thickening or a discoloration of it. We have seen avian influenza in cats, less so in dogs. And in either of these species, you can have your typical signs such as fever, lethargy, low appetite. You can see eyes discharge or nasal discharge, difficulty breathing. You can even see things more intense, such as seizures or incoordination.
Wow. Okay. That is really helpful information. And kind of you touched on this. It seems like there's these specific types of animals. It's called bird flu, so birds, but also cows and cats. Can you talk about how it spreads among different animals and kind of how that works?
Yeah, absolutely. So, bird flu is most commonly spread amongst birds, of course, in any of their secretions, their saliva, their mucus, their feces. And this can live in the environment for a prolonged period of time. So, these birds can then, these migratory birds or wild birds can spread it to our poultry population or our backyard birds or even our pet birds. You can also get the H5N1 virus by ingesting it. So, this can be consumption of animals that have been contaminated, or even unpasteurized milk from cows that have been infected with it. A lot of species are susceptible to it. In cats, when we find it, it's usually because they have been eating a raw diet that is poultry based that has been infected with the H5N1 virus. We've also seen some cases of cats that have been infected by drinking unpasteurized milk. Swine or pigs do get infected, but the mortality and morbidity rate in them, they get much less ill from it, and they mostly just tend to harbor the disease in their body. Whereas in birds, it's a extremely virulent disease with a very, very high mortality rate.
And is there a particular reason that in some animals it seems to be so severe, like birds and cats, versus it being more mild in other animals?
Yeah, and that just really has to do with the genetic makeup of the virus and the surface proteins that it expresses. And so those surface proteins have a tendency to affect different species more than others. And then as the virus mutates, that's what it allows it to infect other species. So the longer that it stays in the environment, in our wild animals, and the longer it's allowed to replicate, the more chances we have that the genomic structure is going to change and is going to be able to be more infectious for other animals.
All really helpful information. And thinking about kind of seeing it in other animals and the different severity in
Mhm.
terms of people and their pets or their own like backyard flocks, what do they do if they think they're sick? What would you say?
Okay. Well, okay. So the most important thing that we need to know is to try to prevent infection. And for this, we rely on biosecurity. So if you do have a backyard flocks or if you do have pet birds, we want to try to isolate them. We want to try to keep them away from wild birds or from migratory birds. If you do have backyard flocks or chickens, then you want to make sure that you're using personal protective equipment when you're handling them, such as masks and gloves and even eye protection, that you be sure to wash and sanitize your hands very well after handling birds or moving birds between coops. You want to keep your feed, your drinking water, your equipment, all of your supplies secure because this virus can live on these supplies. So, prevention is the best measure. You also don't want to introduce any new chickens into your flock unless you know that they are well. You want to quarantine them. For cats, you want to keep your cats indoors. Or pets that do go outside, you want to keep them away from wild birds, poultry, cattle, things of that nature. And that's both, alive and deceased birds. You want to try to keep them from eating dead birds or other animals. And of course, we want to try to avoid feeding them raw meat or unpasteurized milk.
Awesome. Thank you so much. That's really helpful to understand how we can prevent bird flu. And thinking about our pets, we all care about them so much. And this kind of takes on a little bit more of the human side of things. And kind of curious, especially with your perspective as a vet, you deal with animals on a day-to-day basis. So what precautions would you recommend for humans? If their animals are sick as well. Just kind of general precautions to prevent any transmission.
Yeah, and really it comes down to basically the same thing, and that's really just the PPE and the biosecurity of it. So if you do have outdoor animals, backyard flocks, things of that nature that are sick, you want to make sure that you are protecting yourself and you are isolating them during this situation. You can always call your veterinarian, you can always call your animal control officer, you can even call the state veterinarian if you have concerns about avian influenza, and try not to introduce that into your home to your other pets. So, biosecurity, personal protection, using good sanitation, and just preventing yourself from being exposed. As far as concerns with us being exposed from our own pets, that hasn't been demonstrated yet.
Awesome. Thank you so much. I think that covers all the questions that I have. But want to kind of open it up if you have any final information that you'd like to share or feel is important for people to know about bird flu.
Yeah, no, I'm glad you asked that because this virus, it has been endemic in the bird population for years, and cyclically, it has a huge effect on both our poultry production and our dairy production. It just in the last few months, we've had over 160 million birds be affected. And unfortunately, they don't recover from it. Birds usually just show a very high mortality and have to be culled, or infected flocks are tested and culled. The good news is that just as of last week, and this is February of 2025, Zoetis has gotten a conditional license for an avian influenza vaccine in poultry. So hopefully this will help to curb this disease and help to bring our agriculture back to a good situation.
That's really encouraging to hear about the vaccine because I know
Yeah.
this has been, I mean, for us as consumers, the egg prices are going up and it's hard to find eggs. But as someone who cares about animals and also those working in the agriculture industry, I know this has been a tough thing to fight off. So that's really encouraging to hear.
It has. It has. And honestly, I think it's also important for people to realize that if their cat or dog, if their pet does become ill, they're much, much more likely to be infected with one of the diseases that is more common and seen much more commonly in cats and dogs than avian influenza. Only a couple dozen cats have been infected to date, and less than 150 humans have. So if your pet is sick, let's look for the more common diseases before jumping to the more rare and obscure ones. But always call your veterinarian. And if you are concerned about avian influenza, please, please, please use proper sanitation and prevention.
Awesome. Yeah, that's a helpful note. I know a lot of people are afraid for their pets and obviously care a lot. And so it's kind of good to know that yes, they can get sick, and let's look at the common factors first. So I appreciate that note. Like I said, I think that answers a lot of our questions. Happy to have you as a resource, and I appreciate you taking your time to talk with us this evening.
This was my pleasure. Thank you so much for inviting me.
Thank you.